Dr. Deepthi. I'm a consultant pediatrician at Shantanu Clinics and Diagnostics. Thank you all for coming to this meeting. Before starting the meeting, I would just like to introduce myself. I was born and brought up in Hyderabad. I did my medicine at Kamini Institute of Medical Sciences. After medicine, I moved to United States and did my residency in pediatrics at Mount Sinai School of Medicine. After residency, I worked there for 5 years and then moved back to India. Before starting the talk of the day, I would like to take this opportunity to thank Shantanu Clinics and the Chitrapuri community for letting us organize this. The main objective of this meeting, as well as organizing the camps, is to not only create awareness among the community, or strongly say that we as Shantanu family are here for your health as well as your family health needs, and we are here to guide and help you all, and together we are going to build a healthy community. Today I'm going to talk about the most common topic, and after that I'm going to talk about the seasonal diseases we see during this season. So before going to COVID, what I'm going to talk is how, what is COVID-19, what precautions we need to take. Then I'm going to talk about how to protect our kids and ourselves. Then is third wave is inevitable and how to protect our kids from that. And unfortunately, if the kids are affected, and what precautions and care we can take at home to protect them. And at last and nothing not the least is the seasonal diseases. In that, I'm going to stress more about the dengue, since we are seeing more dengue cases. So COVID-19 is a coronavirus disease. It is caused by a virus called as SARS-CoV-2. So it spreads through the respiratory droplets. The main to understand the precautions, first we have to understand how it spreads. The main mode of transmission is in two ways. One is the direct method, the other one is the indirect method. The direct method, what happens is, if an infected person coughs, sneezes, matter of fact, even if he talks, the infected respiratory droplets will directly fall on an uninfected person, and the uninfected person gets infected. And the other method is indirect method, wherein when an infected person coughs or sneezes, the droplets fall on fomites called as, the doorknobs, the door handles, desks and everything. And if an uninfected person happens to touch those surfaces within a time period, and his hands get contaminated, and if he happens to keep his hands on his face and touch his nose and mouth, that's how indirectly the virus enters into the body. Now, as we know the mode of transmission, now we'll talk about the precautions. First, I'm going to talk about precautions in adults. Those apply, majority of them apply to kids as well. So the first and the foremost thing is the mask. So the mask need to be covered, covering both the nose as well as the mouth. I have seen many people outside, they religiously say that they're wearing the masks, but the thing is the mask either is below their nose, or most of them, they have their mask on the chin. But they say like, I wore a mask, how I'm getting infected? This is how, because improper wearing of mask is the reason to get infected. So the mask need to snugly fit and cover the mouth and the nose. It should not be too loose. It should not be too tight. If you are adjusting the mask multiple times, that shows that the mask you are wearing is not an appropriate size for you. So you have to pick another one. Okay, so the wearing mask prevents the respiratory droplets from entering your nose, mouth, and the nose. That is the foremost thing. So children 2 years and above are encouraged to wear the mask. The children below 2 years, we do not usually recommend wearing masks because the airways are too small and there is a risk of the obstruction. That's why we do not encourage wearing mask less than 2 years. And moreover, what happens is when they are getting suffocated, they cannot communicate properly. So there is also a risk of suffocation. And the third thing is they don't like anything on their face, so they try to pull their mask down, play with it. So in that process, what they are doing is they are infecting themselves from the contaminated hands. So we are doing more harm than helping them. So children less than 2 years, we have to not use mask, but how to protect them. So the next step comes into play, which is social distancing. The first thing is to stay home and stay safe. But if you happen to go out, just say, for example, for the kids' health checkup or anything like that, to get vaccinated, then you have to maintain social distancing of about 6 feet, minimum of 6 feet from the public. So you take them out, you maintain the distance, and bring them back home. That's the other thing we can do for less than 2 years kids to protect them. And the third and the most important thing is hand washing. So this hand washing, what it does is it protects us against all the illnesses, like majority of the respiratory illnesses, bacteria, viruses, all kinds. And this hand washing should be done in a proper way, not like okay, 1 or 2 seconds I washed my hand. It doesn't work like that. So you have to use soap and water. You have to apply the soap and wash thoroughly your hands under the nail beds, in between the fingers, and also the wrist, and rinse it off in a running water. And this washing should be there for at least 20 to 30 seconds. That means applying the soap and rubbing your hands together should be done at least for 20 to 30 seconds. So kids don't like to wash their hands. You can make it fun by singing songs, especially the ABC songs usually last for about 20 to 30 seconds. That might help, or the happy birthday song. But the most important thing is kids follow parents. So monkey see, monkey do. So if parents are washing their hands thoroughly before preparing the food, before eating, after coming from outside, after playing, after dealing with dirty dishes, and all that, kids will automatically follow them and start washing their hands as well. After hands washing, the other most important key thing is people who can be vaccinated, please get vaccinated. I've heard from people who are infected even after getting vaccine that, okay, I got vaccinated. How come I got infected? The vaccine prevents you from hospitalization, prevents you from getting severe disease, and prevents you from dying. So please get vaccinated whenever it is possible. We are doing vaccinations right now in India for kids, for adults and kids older than 18 years of age. Please do get vaccinated. By getting vaccinated, we also protect our kids at home who cannot be vaccinated at this time. So these are the precautions need to be taken to protect ourselves against the COVID-19 or the coronavirus infection. And the third one is the third wave. Third wave, is it going to happen? If it's going to happen, our kids are being more affected. So if you have seen or noticed, pandemics usually happen in waves. So in the first wave, the most vulnerable population, like the elderly population, were affected. In the second phase, the middle-aged population, like the 30 to 35 years of age to 50 years of age, are affected. So if you have seen, the older generation by the second wave have been vaccinated. So they are less affected, or even if they are infected, what happened was they showed less signs and they were treatable at home itself rather than getting hospitalized and occurring the severe disease. So the vaccination prevents COVID virus infection for to some extent. Okay, so we need to get vaccinated. The third wave, so if you see the trend in the first and the second wave, so it is affecting mostly the unvaccinated people. So the kids cannot be vaccinated right now, so they might be at a vulnerable position to acquire the COVID-19 infection. We have seen at the same time that in the first and the second wave, the severity of infection was less in kids. This is because what happens is once the virus enters into our body, on the cells there are little spikes which are called receptors. These receptors are less in number. So in that way, the kids are protected. Let's hope it stays the same and the virus is not changing its traits and affecting our kids. Unfortunately, unfortunately, if the kids get infected, okay, what we need to do? So when the kids get infected, even after taking all these precautions, the first thing to do is wash your hands thoroughly. what are their signs and symptoms. Usually they may have like a milder disease to the severe acute respiratory diseases. So they usually divide them into 4 stages. The first one is the asymptomatic phase, which means that they don't have any symptoms, but they accidentally got exposed to whoever is COVID positive, or accidentally, or when they were checked, they tested positive for the COVID infection. So these children, they need to be monitored closely at home for any other signs and symptoms, and supportive care like a highly nutritious food should be encouraged, so that they don't develop any other complications. In the second phase is like a mild disease. In the mild disease, what happens is they have most common symptoms like runny nose or stuffy nose, then the cough, fevers, sore throats, headaches, body aches, all these are the symptoms. But they would be able to maintain their saturations above 94%, 94% or above 94%. And they won't be having any difficulty breathing or anything. For these kids, we usually do the symptomatic care, which means for fever, we use antipyretics, which is the fever medicine. For congestion or runny nose, we use the steam to get all the mucus out. So that's a treatment we give for the milder cases. These kids can be observed at home. And the first and foremost thing in any case is to consult your pediatrician, who will guide you all through your disease process. Okay, and the third one is the moderate disease. In the moderate disease, what happens is the respiratory distress sets in, wherein the saturations tend to drop. They are usually between 90 to 93% oxygen saturation. And respiratory distress, which means the first sign is the respiratory rate, which we measure the respirations in 1 minute. They tend to increase. What is abnormal is for kids up till 2 months of age, more than 60 is abnormal. For kids from 2 months of age to 1 year of age, more than 50 is abnormal. For 1 year to 5 years of age, more than 40 is abnormal, and more than 5 years of age, more than 30 is abnormal. So this, I'm talking to you about all these warning signs. So as a parent, you will be aware of what going with your child, and you will seek appropriate care rather than panicking at what I should do and what is needed. So these kids, the kids who are in the moderate disease process, they need to be hospitalized because they need supplemental oxygen, and to maintain their oxygen saturations above 94%. Okay, these kids, depending upon the severity of the disease, might receive antibiotics. And the severe diseases, what happens is the acute respiratory distress syndrome sets in, the saturations drop less than 90, they need the intensive care management, and multi-organ involvement can also happen. So all these 4 stages, at any point, once your kid tests positive, you have to consult your pediatrician, and then they will guide you accordingly. So some of the parents might start using, like the antibiotics, because here we have easy access to the antibiotics and steroids. They might start using these in the kids, but these are not recommended. Remember, the steroids and the antibiotics are not recommended in the milder diseases. We will be causing more damage to the kids rather than helping them. So it's always better to consult a pediatrician who knows how to treat the kids and start any appropriate medication required. So this is for the kids who have been affected, unfortunately. So then I'll move on to the other diseases which are seen during this season. The flu season, it's almost coming to an end. It also presents with, runny nose, cold, cough, fevers. Fevers usually last for about 3 to 4 days, but body aches will be there. It usually lasts for about 1 week to 10 days and subsides on its own. So the flu vaccine is available. Kids up till, actually all of them should be vaccinated during the flu season, children as well as the adults. But we recommend strongly all kids less than 5 years of age need to be immunized with the flu vaccine during the flu season. Okay, the other one is dengue. So dengue, we are seeing a lot of dengue cases now. Before, it used to be not a serious disease, but now the numbers are increasing, and because of the improper urbanization and all that. So what we see during dengue, and what precautions we need to take, I'm going to talk about it. So in dengue, what happens is it is spread by a virus which is ingested by an Aedes mosquito. It's a mosquito. So when this mosquito bites an infected person, it takes that virus. It's also a virus. So it takes that virus and gives it to a uninfected person when it bites that person. The trick is these mosquitoes, they bite during the day as well as in the night. So we have to be careful and protect ourselves from these mosquito bites. The symptoms of dengue are a little bit similar to the COVID-19. So they have the body aches, fevers are high, headaches are there, okay, sometimes nausea and vomiting are also present in dengue. So it is usually in three stages. The first one is the febrile stage, wherein the fevers are there and usually last for about 3 to 7 days. And after that, it's the most important phase. It's a critical phase. What happens is all the damage caused by the virus, it causes leaking of the fluid into your abdomen, like your stomach, or into your lungs, or into your heart, and causes extravasation. We call it as third spacing of the fluids. Then what happens is shock sets in. So this phase we need to be very careful, and hydration is the key, and the kid needs to be monitored in a hospital setting. And the third one is the convalescent phase, which is usually after this critical phase, where the kids kind of recover. So the main way, or the important way to protect ourselves from this mosquito bites is to clear the water bodies. So these mosquitoes, they lay eggs on the water bodies, as we all know. It's similar to malaria. So clearing the water puddles whenever it rains as soon as possible, and protecting ourselves, by using mosquito nets, or mosquito repellents. Sometimes if you are not allergic, you can also use the mosquito like the repellent creams on your skin, but be careful not to apply on the kids' hands, because they tend to put their hands into the mouth and get exposed to that thing. So this is about dengue. And if you see in most of the diseases, anything is the precautions. If you take appropriate precautions, you can protect ourselves from the disease exposure. Even if you are exposed, you have all the warning signs, then you can treat and take appropriate care for your kids. I always say prevention is better than cure. So getting vaccinated, getting regular checkups, and protecting ourselves is the key, rather than succumbing or getting the disease and leading to like the residual sequelae of the disease. With this, I thank you again for giving this opportunity to talk about this. I'm ready to take any questions. Rashika?
Yes, ma'am. Thank you so much, ma'am. It was really,
Uh,
really useful. And anyone, any questions, anyone?